Fox 61 Morning News begins now.
The Bristol Hospital Counseling Center is hosting a free monthly mental health and substance recovery series. Every month we've had them in to talk about it. The next one's going to happen on Tuesday. That's December 5th, and it's going to focus on anxiety, how to cope with it, and specifically how to seek treatment for an anxiety disorder. Keep in mind, these meetings are open to all of you in the community who are looking for help or just want to take part in an open conversation. So here to talk more about what's going to be talked about, specifically anxiety, I'm happy to have Michael Miarecki. He's a licensed clinical social worker, back with us again. Good to see you again.
Nice seeing you again, Tim.
Yeah, glad to have you here. Okay, so anxiety, specifically disorder, this is just coming from a root of something we all have to deal with. We all have anxieties from time to time.
Yep.
So how do you know when it's crossed the threshold into being one of the anxiety disorders?
So we all have anxiety, right? So you were just saying that. I brought this one up specifically for December because it's a fun time of year for a lot of people with holidays and, you know, getting together with family, friends, outside of work, in work. So one of the things, so anxiety, we all have it. So one of the things when anxiety becomes that point where it's impeding your life. So you're not able to move, you're not able to get out of bed, you're having chest palpitations, tightness in the chest, you're having a hard time, difficulty breathing, you're isolating yourself from your friends, you're not doing the things that you normally would be doing. That's when anxiety is becoming a problem for you.
Yeah, so it's going to be a bit of a judgment call. You have to say, all right, enough is enough. What are some of the more common anxiety disorders out there?
So there's a lot of anxiety disorders out there. There's generalized anxiety, which is just kind of generalized. It's just pretty much what it means. There's social phobias, so being scared of going out into public places, whether it's going to the mall, whether it's going to the coffee shop, whether it's going grocery shopping. And there's also ones that a lot of people are suffering from, especially military personnel, PTSD, post-traumatic stress disorder.
Yes.
So that's another one that's very specific to
talk to me about generalized anxiety. The physical manifestations, I've heard from people who suffer from it, they are absolutely convinced in some cases, and I know this is a case with panic disorder too, that they're having heart problems. They're having a heart attack, and you can understand. They just, it's almost incomprehensible that this is, to a degree, in their head. That's kind of a loaded way, but I'm saying that's not an actual heart problem.
I think sometimes it is. It's that chest palpitation. If that person who's experienced that anxiety has never experienced anxiety like that before, it will feel like they're having a heart attack. It may feel like their heart is beating like 3,000 miles a minute and not being able to kind of control all of that and having trouble talking with other people.
Which probably makes anxiety even worse at that point, right?
So then some people end up going to the emergency room and trying to figure out what is going on for them. So
okay, so if that has happened to you, just at least consider the option that you might have a problem with anxiety and you might need some treatment. Speaking of, talk to me about treatment options for anxiety
There's
disorders.
treatment options for everything. So we have individual therapy that can kind of just doing what's called cognitive behavioral therapy, talking about what the issue is and trying to come up with ways of decreasing that anxiety, whether it's deep breathing, maybe meditation, sometimes just going for a walk, talking with your friends about what's going on. There's the psychiatry side of things, the medical side, getting medication from a psychiatrist, taking that as prescribed, but just being able to just talk to somebody about what's going on for you.
How about lifestyle modifications? Actually, my producer, Bill Welcome, just got in my ear, said, wait, if you have an anxiety problem, what about coffee? What about caffeine? Should you stay away from that?
Coffee is in moderation. I'm going to say in moderation as always, right? So if we talk about drinking lots of caffeine, caffeine is a stimulant to the nervous system. It's going to kind of heighten that what you may already have as an anxiety issue. So, if you're having a lot of anxiety, you're having a hard time with that stuff, then maybe cutting back on the coffee. I'm never going to say stop drinking it, but, definitely talk to your doctor or talk to a psychiatrist about those things as well.
Also, you mentioned this is a big time of the year. I imagine that's just because we have stress from the holidays or whatnot. Is it always easy for people to pinpoint what is causing their anxiety disorders when they have it?
Sometimes it is. So when it comes into this time of year, a lot of people do have those issues of like, oh, we have to be around family. We want that perfect holiday table, whether it's for Hanukkah, whether it's for Christmas. We want that, everything to be perfect. So that is going to raise your anxiety. You have family members that may be causing some issue within that, that family drama that we all kind of experience at times. So that's going to be raising the anxiety. Sometimes people don't know. sometimes if you've never had anxiety before, it might be the first time you've been into a grocery store, and then all of a sudden that rush of kind of all those people around kind of freaks you out a little bit, and you're not really able to understand what's going on for you. Yeah,
there's a lot of different anxiety disorders, as we said. There's a lot of different reasons they can come on. So there's certainly a lot to talk about at this next session. Once again, it's happening from 6:30 to 7:30 next Tuesday at Bristol Hospital's Counseling Center. That's there on North Main Street in Bristol. It could be a wonderful resource for you or someone you love. Thank you, Mr. Miarecki, once again for joining us, as you do every month.
Thank you, Tim.
And glad to have you here. It's a great thing you guys are doing there at Bristol Hospital. Now, when we come back,